this project that I selected myself, and it focuses on it focuses on my perspective on key issues that are facing young people today. The theme of the event, as I already said, is health and well-being, and the structurally is going to be very similar to the other two events. I'm not sure if you guys were here for the first event, but the first event, there's a presentation. So structurally, there's going to be a first presentation by me, which is starting now, and then Ananda's going to speak on the Map at Home project, and we're going to have a series of questions for each panelist. And the panelists for today are Prof Ananda Breed from the Map at Home project, Achabu Kire, a filmmaker from the Change in the Story project, and Participatory Arts for Health Improvement, and Martin Keats from the Bishop Simeon Trust. Okay. The first presentation is by Ananda Breed, and Lauren, could you do the honors of putting up Ananda's presentation, please? Thank you. Lauren.
Do you want me to start now, Jacqueline?
Yeah.
Okay, thank you very much. Thank you for inviting me to share a little bit about the Mobile Arts for Peace at Home project in relationship to how the arts can be used to address mental health provision during the time of COVID. So just as a reminder, Jacqueline, do I have 10 minutes? Is that right?
Yeah, you have 10 minutes to present.
Okay, so you've asked me to respond within my presentation to 3 primary questions that we're trying to address through our project. And those questions include, how can arts-based approaches be translated to online platforms to enhance psychosocial well-being, as well as what lessons can be learned from the provision of online arts programs for psychosocial well-being, especially regarding building resilience against future outbreaks. And finally, how might Map at Home advance digital innovation in the design and delivery of mental health provision and response services in Rwanda? And if you can move to the next slide, please. So in terms of the presentation today, I'm going to give a little bit of a background of the Map at Home project. I'm going to share information in terms of how we delivered the project, which is more of kind of a technical overview, followed by our methodological approach, and then give some case study examples of the lessons learned through some of the workshops that we provided that were online, followed by thinking through sustainability of the project. So in terms of background, I received a call from one of our co-Is, and feel free to stop share now, and I can just speak directly to everyone. Hi. So in terms of the background, I received a call from Chast Uhorai, and Chast is one of our co-Is of the Map at Home project. He's a clinical psychologist, and he basically said, now we need MAP more than ever. It was the time of the anniversary of the 1994 genocide against the Tutsi, and people are experiencing the pandemic in a way in which they were being triggered by the need to go into hiding during the genocide and the lockdown experience that people were having at the onset of COVID. And so we started developing this proposal for Map at Home to think through how we could link arts-based workshops through online provision, and then link that to local level health centers and psychosocial workers, blending psychosocial workers with our master trainers who we've been working with in MAP, which is a part of the Changing the Story project. So Map at Home started with a scoping and a consultation process that was within 5 districts in the 5 provinces of Rwanda. We also were working with our main stakeholders, Rwanda Education Board, the Rwanda Biomedical Center, which is the leading mental health provider in Rwanda, and National Rehabilitation Services. National Rehabilitation Services primarily provides services to former drug users and also street-connected young people. We were working with local health centers and also district hospitals in terms of thinking through at that stage how we would deliver MAP at home, but also using those workshops as an opportunity to define key terms within the Rwandan context, terms like mental health, or even the concept of home. So trying to really contextualize and localize a lot of the terminology, the methodology, and also the provision of mental health service. Then following the scoping and consultation process, Chas and I began developing the curriculum. So we were using some of the curriculum that had been developed already, working with local cultural artists and educators in Rwanda, alongside then the psychosocial workers. So blending between an arts-based approach we were using with MAP with some of the approaches that Chas organization with Singani Amanzi were using to develop the MAP at home curriculum and methodology. Then we started experimenting with the methodology. So we were working with 5 psychosocial workers and 9 MAP master trainers. The master trainers were a combination of youth master trainers as well as adult master trainers to experiment with how we would adapt some of the exercises that we were using in our face-to-face workshops to be able to be delivered online in a way that was dynamic, inclusive, as well. We provided smartphones and data bundles to over 107 participants across the 5 districts. And obviously, because there were different levels of familiarity and comfort with the use of mobile phones, as well as the use of Zoom, we ran a number of workshops to make sure that everyone had the same kind of access to the platforms we were using. Then we started running a series of monthly online workshops. Since we were working in 5 districts, linking mental health users with mental health providers, each month we had 1 workshop per district. So that workshop would be for 2 hours. It would include the psychosocial workers, master trainers, mental health service users as well. And we rehearsed for each of those workshops with the facilitators in advance of those sessions. Then within the actual workshops themselves, Chast Ruhore served as a safeguarding lead. We mixed the way that we use Zoom, going from large plenary workshops to breakout room functions. And the workshops always had a framework in which there was a warm-up activity, a lead-in activity, a main activity, an energizer, and a closing or reflection activity. We also had the workshops recorded, and researchers attended those workshops to take observation notes. Following the workshops, there were basically journal entries that the participants completed, and we've also been developing an online curriculum in which the exercises are translated to an online overview of each unit, in which people can independently upload photos, videos, poems in response to the activities as well. So there was alongside the delivery of the workshops, there was also the monitoring and evaluation of how participants were engaging with those workshops through monitoring and evaluation. Also, the workshops were always followed with WhatsApp, in which participants would respond to their experience of the workshops through WhatsApp as well. So thus far, we've delivered 4 out of 12 units. The first 4 units were based on the themes of exploring emotions, sharing stories, active listening and deep stories. And then the 4th workshop, which will be this month, is focused on integrating family members into the workshops, and also thinking about Map at Home in terms of the connection between the provision of the workshops for the research participants to starting to expand that into the participants' communities. So then I'm going to move now into approach. So in terms of how arts-based approaches can be translated to online platforms to enhance psychosocial well-being, for us, it was through the development of a very blended approach between psychosocial arts-based curriculum that enabled the sharing of stories and the listening to stories through singing, dancing, playing, drawing, and performing. There was an emphasis on the importance of check-ins that were in between each of these monthly workshops. So I think one of the reasons the project thus far has been quite successful has been because there's a lot of on the ground work happening between those online workshops. So the 5 psychosocial workers are working directly with the research participants to check in on them following every workshop. Likewise, participants are completing their journal entries and sharing their experiences and their stories of change with us. So I think what's really important is that balance between the online provision, but as well as some of that continued face-to-face work that's happening and the relationship building that's been quite important, both between the psychosocial worker and the mental health provider user, alongside the community that's being built online as well. So in terms of the second question, what lessons can be learned from the provision of online arts programs for psychosocial well-being, particularly regarding building resilience? There's kind of a case study or an example I want to share about that. So one of the exercises is called Umbrella, in which people are asked to draw an umbrella. We also use a whiteboard for this function. And then to talk through when there has been rain in your life, you know, problems or experiences you've had that might be the rain. And then what might be the umbrella? What helps to protect us from the rain? What has kept us safe? So first there's that discussion about the rain and the umbrella. And then following that particular exercise, we went into breakout rooms. And at that time, people were invited to share a story. What I think was interesting about this particular workshop is that when we were in the breakout rooms, one woman shared a story in which she was working and a neighbor came to her workplace and told her that there was a flood. And the flood had swept away many of the houses within the village, and that her child had been swept away as well. She ran home, and what he had told her was true. Her child had been literally swept away by the flood, by the rain. And when she was sharing the story, she was using the metaphor of the rain, that she has experienced so much rain after this experience, but that, you know, she's found that the umbrella recently has been the map workshops, that's been her umbrella. And being able to tell her story serves as that umbrella. So what I thought was really quite striking about this example is one, kind of how the arts-based approaches serves as a kind of safeguarding. So the idea of moving into that exercise in a way that we were talking about the rain, we were talking about the umbrella. So in that exercise, we were inherently talking about the link in terms of resilience between the problem and the solution, and moments in which we all have have had that synergy between the rain and the umbrella. And then in the next exercise, the woman who shared this deep story was quite organically able to bring both things into that story making. And so I think that's something interesting to think about, is how might arts-based approaches as a method, particularly if we're talking about mental health, serve as a safeguarding mechanism? How and why? Within the Rwandan context, also, there's a strong use of metaphor and the use of proverbs. That's another thing that we do quite often and throughout the Map at Home project, is use proverbs as kind of the frame of any exercise. So you immediately go into kind of a context within the culture, as well as thinking through almost archetypal and deep kind of ways of positioning yourself. So that's been really quite key to the strategies that Chast, as our co-I, uses within the way he works. So I think that's really important too, is positioning, not just yourself as an individual, but also how are you positioning the community who you're working with? And how are you positioning yourself from past, but also to the future and within the present? So I think there's quite a lot to unpick in relationship to, what does an arts-based process bring to these kind of approaches in relationship to mental health. And then the final question was, how might Map at Home advance digital innovation in the design and delivery of mental health provision and response services in Rwanda? So in terms of that question, following the delivery of the online workshops, what's next is thinking through kind of the scaling up of the project. So right now we're working with 2 health centers and 1 district hospital in each of the 5 districts. But because of the success of the project, Chast is receiving calls from pretty much every district now, just saying they want to roll out to all the health centers in their district. So that is, as an example, would be going from 2 to 14 health centers in each district. We've also been asked by the National Rehabilitation Services to provide Map at Home for their 1,500 street connected young people. So what we're thinking through right now is how, following the online workshops, can we be working with the community who's taking part in the Map at Home workshops right now, working with them and thinking through how they continue to lead the workshops, how they continue to adapt the exercises to their communities, working with the health centers, working with the district hospitals as well. We're also working with the National Rehabilitation Services, Rwanda Education Board, and also the Rwanda Biomedical Center in terms of thinking through how Map at Home might be able to align with the current programming of mental health within the school systems. So I think I'll close there, if that's all right, Jacqueline, if that was enough, if I covered everything you wanted.
That was more than enough. Thank you so much, Ananda, for the detail. It was amazing, so insightful. The next person the next panelist is Martin. And I asked Martin to create, hi Martin. 5 minute, I think you're on mute. I think you're muted.
Sorry, I was delayed joining you. I had a connection problem. I just had to travel two miles on a small motorbike to get to somewhere else so I could speak to you. So there's an image for you all to live with.
Yeah. So you're working with the Bishop Simeon Trust, and asked you to create a 5 minute presentation about, health and well-being, and how the Bishop Simeon Trust kind of deals with that.
Yeah, sure. So the Bishop Simeon Trust was originally founded 32 years ago now, and we rose out of the essentially the anti-apartheid movement, were named after a guy called Bishop Simeon Trust, who was bishop in the High Veld at the time, which was to the east of Johannesburg, and he was a close friend and ally of Archbishop Emeritus Desmond Tutu. Everybody knows Desmond Tutu, but people don't really know Bishop Simeon. We were originally founded around the idea of the potential of youth and to support education, which was very difficult for young people to have access to in South Africa at the time. We've developed over the years, so now we work to support the development of what are called safe parks in local communities, which provide a safe space and access to support, counselling, health services, social workers, basically everything that children might need, either within the centres or signposting for. Within the centres and around that work, we've also developed a youth leadership programme, which is where we've worked very closely with the University of Leeds over the last 6 years now, in developing our youth-led filmmaking project. It'd probably be helpful just to sort of locate it in terms of the health and well-being. I think that's important to talk about. I mean, hopefully you've watched the 2 films that have been part of this, and obviously I'll be happy to answer questions about them. But the whole program is focused around developing youth committees within the safe parks. And those youth committees are self-selecting. We don't go in and pick the best kids. It's for young people who want to be engaged and involved in them. And then what we do is we support the youth groups through the provision of a youth leadership program that assists them, that is focused around the arts. Over the years we've used a number of different approaches to this, based around a lot of the theatre of the oppressed kind of approaches, using forum theatre to help young people to explore issues in their lives, to produce and direct small plays that deal with principal issues that have varied from HIV/AIDS to abuse, to sugar daddies, to alcoholism, to the big issues that they face, the drugs and gangsterism in the communities where they are. I mean, South Africa is famous for being a culture that is really quite violent in the townships, and that is borne out by the experience of the children that we work with. In terms of how the model works, it tends to operate on a 6-month cycle, and we work with them to develop what we call campaigns rather than just films. You know, it's not just film for film's sake. It's for them to work together and use the arts to identify stories that tell the problem, but also the resolution. You know, what are the solutions to these issues that they see in their communities, which itself is an empowering approach. You know, we've referred to it previously as the process of imagining power, from a situation of powerlessness, by using an artistic space through which they can create a story where they can be honest about the things that happen in their community, while essentially making them a fiction. So it's not pointing fingers to specific people, to use the arts as a space to create safety for them to explore these things that may otherwise be taboo or too sensitive to discuss, whilst also taking power, because in this space they can create a solution. They can imagine what the solution would be, and they are supported to identify those resources available to them within their communities and in the safe parks, in the schools, in the health services, to understand this. And by doing so, sort of exploring really a number of different things. Article 12 of the UN Convention for the Rights of the Child. Every child has a right to be heard and to participate in decision-making about their lives. But also, you know, the rights that they have in South Africa under the Constitution and the Youth Act there. And learning about these things in the process of doing it. In terms of health and well-being, I think there's a number of things about this process. You know, at the conclusion of the filmmaking, it's not just they have a nice film. It's that the films are used as a campaigning tool. It's something that is shared cross-platform amongst peers. It's a fascinating thing because the films they are written, they are directed, they are filmed, they are acted. Everything about the films is made by the young people we work with. So these films aren't made for our eyes. You know, they are speaking to their peers, the people around them. They are filmed in locations familiar to everybody. And they're about issues that are familiar to the people who are watching them as well. And there's lots of bits that we can watch, and it feels to some, it's been described, I've had people describe them as like naive art to us, which I understand, but I think is a bit patronizing, because I think actually there's a high level of art in what they produce. When it comes to the health and well-being, I think there's a number of areas. I think the opportunity to talk and explore these issues is really very important to them, because it's in a safe space where young people may not have been able to discuss these things before, or to recognize that other people had had similar experiences and had had to confront them, and that it's a space where they can also find solutions to things that may be still living issues for them. It's also the process of using some of the theatre for the oppressed tools means that actually it's almost like the game of whispers around the room as people create a story that is true-ish, but isn't specific to anybody in the room. In the process of implementation at every stage, safeguarding is very important to us. So the groups are supported by auxiliary social workers, who are essentially caseworkers for all of the children who attend, and they provide support within a safeguarding framework for them. What we've seen over the years of doing this together is that the process itself becomes a means of early identification. We're very mindful that in exploring these issues, that it can lead to the reliving of trauma for young people who may have been through some of those things. So we're very sensitive to that. And it was interesting to hear Ananda talking, and hi Ananda, by the way. But it was interesting to hear you talking about that checking in process with people, because we do something very similar in between the sessions of the youth leadership program and the films development and the whole process we have in place, so that the auxiliary social workers are able to speak with the young people. Because also, you know, it's a good thing that they're able to identify that there is an issue that can be addressed. Because without the process, you know, the mental health and the well-being of children where there are issues might not be identified. It provides a space and an opportunity for interaction and identification of support needs, which is very important. I think that, sorry, am I running out of time, or have I?
Yeah, I think it's time for some questions regarding the films, the two films. Yeah, it's perfect timing. In the two films I picked were Malume Uya Limana and the human trafficking film. And the first film focused on sexual violence with young people, and the other film focused on human trafficking. And okay, so I'm conscious about you've answered some of the questions in terms of like your speech, so I'm gonna be selective, so to avoid repetition. Okay, do you believe that the children involving themselves with the project was important in educating them about the issues?
Yeah, absolutely. Yeah, I think that in both cases, I mean, what you had with the children coming together was the sharing of knowledge and experience, which may have been different across, but also you had some children who had experience of being supported in responses, you know, in resolving issues. So the children involved in the project itself learned about the resolutions, the potential resolutions to the issues, as well as the nature of the problems. And that, you know, also quite simply for, you know, the level of disempowerment amongst many of the young people, and particularly the young women, is such that the awareness that these things were wrong, you know, that there is something that you can do about it, itself is a point of education, which, you know, that kind of fact forces you to step back a little and think, okay, you know, actually we think these projects are going to work from this point, but actually they start, the impacts can be much earlier in just awareness that these things are wrong, that, you know, something can be done about it and should be. So yes, absolutely.
Yeah. And do you believe that there's a lack of accountability from the adults in a lot of these situations when we talk about sexual violence towards young people?
Yeah, I mean, it's really, this is really a really interesting point, just along, so it's something that's common when we've looked at a lot of the films that we've done. So what we've built into the model over recent years is that at the end of the campaign cycle, you know, one of the audiences that is targeted with the campaign films are the parents and guardians of the children. So what they do is they have a showing where they show the film, and then the children who are in the film then do a Q&A in character. So they come in as the characters from the films. So they're acting, but as those people, but also those children have the knowledge of the subject and the discussions that have taken place in the group, as well as their experience of their community as children. And it creates this really fascinating space for dialogue, cross-generational, which is really very important. So we've had a common thing. So I remember one question, one of the groups was the parents, one of the parents put their hand up and said, in your film, all the adults let you down. Is that how you see the elders in your lives? And all the kids said, yes. And there was a silence. And then because there was a realization from the adults that there was a problem with them, that this wasn't a problem with the kids' perception. And it actually led to a longer discussion where the kids in character were able to say to the adults, well, the only interaction I have with my parents at home is around chores or schoolwork. You know, there are these things happening around us, and my parents won't talk to me about them, about the gangsterism, about the rape, about the drugs, around HIV/AIDS. And the conversation developed. So you have parents saying, we struggle to talk to our children about these issues because we remember them from when we were children, and we are terrified for you. Which was a really powerful admission from the adults. And what, you know, that dialogue hadn't happened, and it wouldn't have happened without this process. And what it led to was a process of mutual, of recognition of the need for better dialogue between the adults and the children, and the cost of not doing so because you're afraid, as well as the identification of support for achieving that through the services in the safe parks as well. So yes, absolutely a lack of accountability for the adults, but actually the project itself opened up dialogue about that, which was vital.
Wow. Okay, that's great to hear. With the next film, talking about human trafficking, there was an aspect where you took the film focused on rituals, a lot of rituals that happened in the community. And do you believe that poverty is the main reason why people turn to rituals, or do you think other factors such as culture or lack of education might come into play?
I think there's a number of things about it, really. I think desperation, you know, for a solution. You know, I think it, you know, not, and you know, this is one of the things about the way in which we've developed it. So it's problem resolution within the campaign films. It's actually, you know, to seek other resolutions, other means, rather than, you know, going towards this ritualism, which, you know, is just ineffective, violent, and brutal for the ones depicted in the film, which occur and happen. You know, that's from stories. I think there's a number of other different aspects within this as well, and I think part of it is I think it's about colonialism, because, you know, many of the kids identify as within strong Christian communities, which is, you know, people are allowed to choose their faith. I'm not saying that. It's just a matter of within, you know, it's a colonial thing to then look down on traditional beliefs and be suspicious of them, and to think that they are all about these things, which is unfair on traditional beliefs to a certain extent. You know, the people who do the ritualism depicted are really, if they weren't doing that, they would do other things. You know, it's a route to power and money, and within the community that they use, they would be gangsters. in another means. It doesn't. So I think there's something about that in there. But I think, you know, education is at the heart of it. Awareness that, you know, that this is wrong. That, you know, and the other, I think one aspect of it as well, whenever I see these things, is it's always young women. It's always young women. So there's a gender aspect in this, and it's about the status of women within the community. And the need for education about rights, solutions, capabilities, and all these things, really. It's a complicated one. I mean, I find that film really interesting because I find big bits of it personally problematic. But, you know, it's their voice and their depiction, but it is something that we began to unpack with the reflection sessions afterwards. And unfortunately, that was kind of curtailed on that film by the COVID pandemic.
Yeah. Another thing that I picked up on it with that film was a lot of people tended to stay quiet when it comes to human trafficking. So I just wanted to ask, why do you think that is? Why do you think so many people choose to just ignore it or turn a blind eye to it in the community?
I think people are afraid. You know, I think, you know, South Africa, you know, during the apartheid era, you know, we had the story of the graduation to the Rainbow Nation. And within that, you know, the solidarity within communities was around street committees that mobilized in the face of the oppression that they were facing. But actually, you know, a lot of that solidarity within the communities has drifted. You know, so you know, they've been subject to years of HIV/AIDS decimating communities and the structure of the family and the solidarity that existed. You've had persisting poverty within these communities and disillusionment and, you know, gangsterism sort of replacing the solidarity. I think people stay quiet because they're scared. So what you've got is people tend to retract into their homes and not want to engage for fear of retribution and violence. I mean, I don't know if you've seen the news from South Africa in the last week, but you know, there were 10 deaths the other day, you know, with the rioting and the, you know, around Zuma going to prison and everything. There's, you know, it's a bit like a bottle that's been shaken a bit violently and only has a small cork in it. You know, there's people don't want to sort of engage and cause problems, so these things happen. And, you know, the police services just can't cope. So it's either you confront it yourself or you leave it alone.
Okay, thank you, Martin, for that amazing speech and, you know, discussion. I think I have to move on to Achabu right now because for time purposes, but thank you for stopping by. Amazing. Achabu, the last film is by Achabu.
Hello, hi everyone. So yeah, so I hope you have watched my film, and then I'll just start with a brief overview of the film again. So the film tries to explore on the mental health and well-being of the young people here in Nagaland, and then it has also a special focus to art-based organizations and their services to young people here. So it's just a very simple film where we try to explore the role of few organizations engaging our youth here in Nagaland. And then for the first part of the film, we have approached 2 mental health service providers. So at the government administrative level, it is the State Mental Health Institute, where we interviewed the senior psychiatrist there. And then through the psychiatrist, we have learned that the key contributors to the mental health problems here within our youth includes unemployment issues, parental and societal pressures, and a lack of awareness on mental health from our young people's part, and then poverty, family conflict, and then substance abuse, and the list goes on. So yeah, he shared with us few key contributors that he thinks is contributing to the mental well-being of our young people here. And then the second mental health organization is an NGO, non-governmental organization, and then it is one of the only organizations here that provides mental health services to the young people at the non-governmental organization level. So yeah, we also interviewed the director there and 2 of their counselors, and then through them they hold activities for young people where they kind of a free space, and where the young people can just express themselves freely, and they also conduct different focus group sessions with a group of young people where these young people can interact with each other, their issues to each other, and then open up on discuss among themselves. So yeah, and then these organizations have also presented hello.
Hello? I think it cut off for a second.
I hope
Yeah.
I'm audible.
No,
Yeah,
it's
my network
okay.
went off.
Yeah.
Yeah,
In
so
terms of, I sent,
yes,
Mhm. I think
okay.
there's a
So yeah,
delay.
can
Yep,
you see?
yep,
Can
I
you
think
tell?
it's working. It's working perfectly now.
Okay. So yes, the organization, mental health organization, here also presented some of the challenges they face as a mental health organization, as in the lack of people's understanding nature of the work. Since mental health is a qualitative kind of work, so the outcome and the result doesn't show, and people don't understand the result and outcomes of the work. So in that case, also they struggle with getting any financial assistance. And then yeah, the other challenges include very few number of mental health professionals here in Nagaland. So even if there are cases that they want to refer to, but yes, even if there are cases that they want to refer, they can't do that because of the lesser number of mental health professionals here in Nagaland. And then regarding the other 3 organizations, the art-based organizations, I just choose them based on their services, the skill development. And then yes, and these organizations also aim to kind of empower the young people in terms of financial assistance also, so that young people can empower themselves, and then through some skills that they provide them, and then they can kind of become independent and yes, live on that also. And then yeah, the 2 of the organizations, the Art Village and Goka, it is solely based on fine arts. It is based on fine arts organization. And then these 2, they provide a platform for the youth, for them to train. They also train the young people to in the field of fine arts, and then they also help the young people in selling their art. They also provide a platform where the young people can sell their art and stuff. Yeah. So those were the organizations that I've approached and then interviewed. So, shall I come to the key questions that you have asked?
Yeah, so there's a couple of key questions that I asked. So I think we should start with, do you find that young people find it easier to talk to a counsellor about their issues as opposed to the school or the teachers or like family around them, or through these art-based organizations, from the organizations that you interviewed? do you think it's much easier for them
Okay,
to
yes,
express themselves through the arts?
yes. I ponder on that, and then based on my experience and understanding, I think young people are they are ready to open up. Actually, they're ready to open up to anyone who kind of is trying to help them, or who is trying to provide them with some assistance in their problems and issues that they're facing. But the only problem here is that we do not have much professional counselors, and then so even if the counselor is genuine enough to help and assures the young person to keep the matters within themselves and stuff like that, then I think the young person will obviously open up to the counselor. Yes.
Thank you. The next question is more related to now. In terms of COVID, how do you think that's affected the young people in Nagaland? And how do you think the arts organizations that work in Nagaland are trying to tackle it or have tackled it, from your opinion? Or how do you think they should tackle it?
I've also done some research on it, and then find through a source that the Directorate of Health and Family Welfare here in Nagaland has conducted a survey on the mental health of young people also below the age of 30 to 16 years. And then they have come to the conclusion that this age group has significantly higher risk of experiencing depression, especially during this pandemic. So yes, there has been a lot of contribution, even in my opinion. And then I've also asked around the mental health service providers, the NGO, Serendip Guardians. So through them, I've also learned something. And then I was also thinking myself that on the issues that might be creating such kind of mental health issues within the young people here. So according to the Serendip Guardians, in the first stage of the lockdown, it has more to do with anxiety related to fear, and then dealing with loss of jobs and their livelihood and such. And then, in my opinion, and what I've seen is that for the fear as in finding out their loved ones and even themselves testing positive for COVID has also contributed a lot of worries and anxieties within the youth. And then there is also lots of fear of contracting the virus that has instantly disturbed our mental health. And then yes, it has definitely taken a toll on the young people who have lost their jobs due to the constant lockdown that is imposed here in our state. And then education-wise also it has been disturbed. And then especially for the lesser privileged section of the society, for this group of people, their struggles included worrying for attending their online classes due to the lack of facilities and digital gadgets that requires for an online class. In the second phase of lockdown, it has more to do with adjustment issues that is trying to adjust with the lockdown, and then related issues, frustration, and then for some it is family adjustment issues also, and then problems between parent and adult children has also been seen throughout the pandemic lockdown. And then there has also been seen a rise of use of alcohol consumption, and then yes, lots of problems such within their own family has also been seen in such kind of problems, even marital.
Yeah. Okay. The last question I wanted to ask was, what is the message that you would like to put across for anyone who watches the film or this event regarding your project?
hope I'm audible. Hello, I hope I'm audible.
Yeah, hello? I think there's a delay.
Oh, yes, yes.
Yeah. Do I need to repeat the question?
So, okay, sure. Yes.
Pardon?
Hello, Jacqueline. Can you please?
Yep, hello? Yep.
Yeah.
Yep. The last question was, what is the message that you, what is the message that you like to put across for anyone that watches the film or this event regarding your project?
Oh, yes. So, yes, through this film, I just wanted to convey a simple message that mental well-being is equally important as physical well-being. And then this film was mainly to create awareness among the people, and especially since mental health is a very less talked about issue here in Nagaland. And then many are not even aware of what the term is meant by mental health. And then, yes, there's lots of ignorance among the community and public on the matter. So, yes, I just want to convey that message. And then I also wanted to convey that to achieve a state of mental well-being for the young people, the struggles and insecurities need to be captured, and that they need to be provided with proper guidance and opportunities from where they can feel included and valued, and even express themselves positively. And then the need to appreciate and support their talent, dreams, so that they can be able to move forward in life with hope and resilience from the many mental health challenges that they face daily from their life. And then also regarding the art part of the film, I just wanted to add that art, when created for a good cause, can become a great platform where the young people can express themselves and their thoughts and creativity and empower themselves and even their peers for a more positive outcome. Yeah, that's it.
Okay, thank you, Achabu. We have 5 minutes left, and if there's any questions, you can join the chat. You can include it in the chat, or you can turn on your mics. It's open to the audience, and the questions can be for any panelist of today. There's any questions?
Can I ask a question?
Yeah.
So I think the work that you've been describing is really fascinating, and some of the most important work that I think has been taking place in changing the story. Particularly, you know, we couldn't have planned this at the beginning, but the fact that COVID has obviously been having mental health impacts on all the participants that we've worked with, you know, is really clear. There's often lots of talk about arts-based practices having a kind of therapeutic function, and I've always been a bit nervous of that. Not least because quite often when you read applications for funding, sometimes it's just sort of thrown in with very little thought about it. What always impresses me about the project you guys have just been describing is about how, you know, you're not doing this by chance. You're doing this because you've thought it through and you've got proper professional psychologists, safeguarding officers working with you on the project. I wondered if you could give us a sense of what you see as the main challenges of doing this kind of stuff, and what you see as the sort of pitfalls of attempting to kind of focus in on mental health and well-being in arts-based practices, you know, in terms of kind of what people that are doing it that maybe aren't as kind of professional or proficient in it as you guys. What do you need to be wary of if you're setting up a project? Because we know that people will always continue doing this, so it'd be good to kind of get a sense of, you know, what advice that you can give to other people on setting up these kinds of projects. And that's a question for anybody that wants to respond to it, I guess.
I just note that Chast is with us now. Hi, Chast,
hi.
from Wasingani Amanzi. So I don't know, Chast. Hi, welcome. I don't know if you want to respond to that. Like what advice would you give in terms of how to set up a project? like Map at Home or otherwise? Or any response you want to give, obviously, to Paul.
Thank you very much for everybody. I'm sorry I was a little bit late, but really this is a very wonderful discussions. And I would like more to focus on the importance of the use of arts in the healing process, in psychotherapeutic settings, and how it can somehow can be, if I can say, be solved, be scale up. First of all, basing on MAP methodology, where we developed a curriculum composed by, if I can say, exercise, arts-based exercise. Let me saying using like songs, like drawings, painting, like so it's a very easy. You know, in mental health, we use mostly how can I say, some, if I can say, difficult conceptualization. When you go to psychoanalysis perspective, you even different psychotherapeutic perspective, those are so if I can say, complex conceptualization. But when it comes to arts, it's well translate and make, if I can say, the emotion, the feelings, those what I can characterize as abstract pains, and those abstract pains, which cannot be sometimes be diagnosed by any empirical how can I say, empirical laboratory, any empirical tools, but the people who are mainly young people who are expert of their lives, it's very easy to show you their feelings, their emotion, their pains through arts, through different arts, and it was very easy. How can I say, to externalize those emotion and psychological feelings and pains. It was very easy even to build trust. With the recent project we are doing online, Map at Home, where of course we do organize those online workshops. It's very easy to build trust, to share stories by using those arts, and it's also easy to contextualize, because through arts, it's different from those complicated concepts I was referring to. You just talk in your context, in your language, in your court. In Map at Home, we use mostly proverbs, and it's very easy. In Rwanda, we have rich proverbs, which really can easily give a message, either a message of if I can say, of sadness, of anger, fears, but also comforting people. So through those that conceptualize using arts, even people, they have been interested. They have been interested, and they are starting, even we are starting to integrate this, if I can say, mental health arts-based methodology within even health facilities, government health facilities, hospitals, health centers, and the rehabilitation centers, which are supporting young people addicted to drugs. They are requesting support. So meaning that if we how can we engage those institutions, it's sellable and it's easy to scale up, and it's even how can I say, it's even to sell and to be integrated within policy. I was discussing with somebody from National Rehabilitation Service this morning, organizing. We'll be organizing a workshop and to see how this methodology will be integrated within the program, or the whole program of rehabilitation. So I will say arts are very important, and we should engage those local implementers, and after engaging with them, it will be integrated in a, if I can say, national programs and national policies. Thank you very much.
Okay, thanks. Thanks, Chas, for that speech. Is there anyone else that would like to talk about answer Paul's question? There's no one else?
Yes, me. I would like to, please.
Like
just very quickly, just to pick up on what Chas says, I think it's a very good point about. I think one of the challenges we face is to make sure that the project that we're doing with our local partners is integrated within their services. I think to do that, it's to make sure that the auxiliary social workers can see that the work itself contributes to the outcomes they're pursuing for the children. But that for us also, that is reflected in terms of, the ultimate prize on this is in terms of it being adopted into national policy within South Africa, so that it can fit in with the drop-in centre model that is subject to statutory funding. But in order to do that, it's a bit of a long game. Policy changes isn't an overnight thing. And the thing that we have to be able to do that I think is there's much more work to do, even though we've been at this for 6 years. There's a lot more work to do to be able to demonstrate better outcomes for young children, for the integration of arts-based approach with social work and health and well-being. And in order to really get the policy people to respond on this, we also have to be able to demonstrate that it's cost effective or cheaper, because that's where policy people sit on these things. It's about the outcomes and the cost. But I think the starting point is to make sure that there's a true appreciation of the integration between the work of the auxiliary social workers and the arts-based approaches that we do with the children, that they mutually reinforce each other.
Yeah, thanks, Martin. I'm conscious of time, so thanks everyone for joining us. Amanda, Martin, and Achabu, and all the other panelists and the people that join us. Today, I think that's the end of the event. Yep. So today's event focused on health and wealth, and we did this by revisiting the influence of arts organizations in helping the youth in post-conflict societies. Okay, thank you, everyone.